Hello, my name is Charlene Hagerman. I'm a nurse with the North Simcoe Muskoka Hospice Palliative Care Network, and I'm going to be doing a presentation on expected death in the home protocol. So just an overview, the EDITH Protocol supports end-of-life care in the home and the individual's expressed wish for no resuscitation when their heart stops beating or they stop breathing. So our learning goals for this presentation are: what is an EDITH protocol, why is it needed, when is it required, and the process for completion of the EDITH protocol. So what is the EDITH protocol? It was developed back in 2011, and it supports the development of an end-of-life plan to identify the plan for pronouncement or certification of death in the home and to allow for a timely removal of the body to the funeral home. It's a bright yellow folder containing 3 documents: the DNRC form, the death certificate form, and the expected death in the home form. The North Simcoe Muskoka Lynn Home of Community Care provides these folders to the nursing providers. Why is it needed? It provides increased support for the end-of-life patient, family, and care team. It helps to increase communication between the multidisciplinary team, and it helps to provide clarity to roles, responsibilities, and activities involved in a home death. And it will reduce the inappropriate access of emergency services and coroner. So when is it completed? Just to review, an expected death refers to when, in the opinion of the healthcare team, the patient is irreversible or irreparable terminally ill. That is, there is no available treatment to restore health, or that the patient refuses the treatment that might be available. The patient wishes to or has the potential to remain in the home for end of life. Preparation or discussion must take place prior to a patient reaching a PPS of 30%. So this is a palliative performance score of 30%. And at this time, the patient is often bedbound. Intake is very low, requiring increased care needs. And sometimes it's appropriate to do this protocol a little bit earlier if there is a more rapid change in health status. So who completes the EDITH protocol? The healthcare professional who initiates the discussion. So often that's the North Simcoe Muskoka Lynn Home of Community Care coordinator, the visiting nurse, or the palliative care nurse practitioner. This discussion is done with the family, and if appropriate, you might want to include the patient. So contact is made with the most responsible physician to discuss the certification and pronouncement plan for the EDITH protocol. We need to confirm with the physician what his role is and what his desire is as to, at time of death, will he be the one coming in to pronounce the death and complete the death certificate, or does he wish that the visiting nurse be called to do the pronouncement? We need to ensure that the physician is aware of the location of the funeral home and review the expectation that the physician must complete the death certificate within 24 hours of the death occurring, and that death certificate needs to be received by the funeral home. And we also need to ensure that the physician gives an after-hours contact information for him or herself. This plan is to communicate the plan to the North Simcoe Muskoka Lynn Home and Community Care, so including the name of the funeral home, contact information for the physician, and who is responsible for the pronouncement. Is it going to be the physician himself? Might it be the palliative care nurse practitioner that's involved in the care, or might it be the visiting nurse? So the nurse, physician or nurse practitioner that comes into the home to pronounce completes the third section of the expected death in the home form and notifies the funeral home of the death and the completion of the pronouncement. If the nurse is pronouncing, the funeral home will arrange with the physician or nurse practitioner for the completion of the medical certificate of death. If we're unable to reach the most responsible physician or the nurse practitioner within 24 hours, the on-call coroner may be needed to be contacted if there's no other alternative physician that can be called. So the documentation piece of the EDITH form. So the EDITH form itself is in triplicate. So the white copy, which is the original, once completed, gets faxed to the North Simcoe Muskoka LHIN. The pink copy is retained by the funeral home, and then the yellow copy remains in the folder and is usually removed by the service provider after death has occurred. The Do Not Resuscitate form is part of the protocol, and it can be completed either by the physician, the nurse, or the nurse practitioner, or sometimes the LHIN Home and Community Care Coordinator, who is a nurse. And this is done after a discussion with the patient and the family as to the resuscitation directive. The medical certificate of death is to be completed and signed by the physician or nurse practitioner after death has occurred. It's not to be pre-signed, and it should be signed and, as I mentioned, gotten to the funeral home within 24 hours. The expected death in the home form has 3 sections. The top section has the patient's name, date of birth, health card number, and the date the form is completed. It has the physician's name or an alternative physician and after-hours contact information for them. It also contains the name of the funeral home and who was contacted at the funeral home and the phone number and fax number of the funeral home. The middle section is the pronouncement or certification plan, indicating who is pronouncing and certifying the death and who this plan was confirmed with, which doctor or nurse practitioner, when this plan was confirmed, so the date and time that this was discussed. And if the nurse is pronouncing, then the nurse's agency number and after-hours contact information is included here. So any special circumstances are also noted in the middle section, such as if there is any organ donation, cultural or religious practices to be observed. The bottom section contains the pronouncement information, including where, what time, and by who, the name and time the doctor was notified of the death, and when the funeral home was contacted. Also in this section is any awareness of any infectious diseases and if the coroner was notified. And if the coroner was notified, the name, the date, and the time he was notified is noted here. So considerations. We need to prepare the family for end-of-life changes that commonly occur. We need to ensure the family knows who to call and when to call. We need to reinforce not to call 911. The EDITH protocol is often left on the top of the fridge in a home. If the resident or the patient is in a retirement home, then there needs to be communication between the care providers going into the home and the retirement home staff as to, at time of death, who is to be called to pronounce or certify the death. And if there's any changes that occur with the protocol along the way, then these changes need to be communicated to the North Simcoe Muskoka LHIN Home and Community Care Coordinator. So if the nurse is pronouncing, she should be contacting the funeral home after she comes into the home. She needs to be aware and very sensitive of any rituals around the time of death and the handling of the body. And if possible, allow the family to spend time with their loved one. She needs to be aware and share the plan that in the event the patient dies during the night, what is the plan? Will the family be waiting till morning to call in the visiting nurse or the physician, or do they want the nurse to respond in the middle of the night? So that really needs to be a discussion in the event that that happens. And they also need to speak with the family if they want to be witness to the body leaving the home. Other considerations, so for patients that access medical assistance in dying, the North Simcoe Muskoka Lind Care Coordinator, along with the patient's healthcare team, will support an individual process that will be complementary to the EDITH protocol. Currently in Ontario, physicians or registered nurses with extended class, so that's the nurse practitioners, who provide MAID will have a reporting procedure to follow directly following death. So in conclusion, the EDITH protocol is an important tool used at end of life to enhance communication between care providers and to ensure dignity and respect for the patient and family. Completion of the EDITH protocol will eliminate the need to call 911 and emergency services such as paramedics and firefighters. Of note, if there is ever any suspicion around the circumstances of the death, even if there is an EDITH protocol, notify the doctor to discuss prior to calling the funeral home. So that concludes my presentation. These are just a few of the references that I used to create this presentation. And if there is any questions or any further education required, please reach out to the North Simcoe Muskoka Hospice Palliative Care Network. Thank you.